Okay, so hello and welcome to the 2020 Center for Excellence in Collaborative Education poster listening tour. It is our 10th year of being together and learning from and about each other, but this is certainly our first time virtually producing this poster session. And I want to say hello to everyone who's there, and your children and your dogs and whoever else roams through the room while we are doing this presentation. We were really surprised and pleased that we got 22 posters from our students, especially considering how busy and crazy this time has been. And those 22 posters represent all of our colleges and most of our programs, and makes us feel very, very positively about UNE's impact in interprofessional education. I want to start by thanking the leadership for all your support in keeping us afloat and keeping us growing and expanding our collaborative education efforts. I also want to say many, many, many thanks to Michelle Cody and to Lee Cody and to Ben Gray and Julia Berquist, and of course our totally amazing Chris Hall, who I will be introducing in just a moment. I refer to this as a listening tour. You will get a glimpse of the posters and their authors, but you can also find these on Dune later on, and also in the Facebook photo gallery, so you can get a better look at the details and the information that the students have put forward. So thank you so much, and I would like to introduce Chris Hall, the program manager of our CECE.
CECE, thank you, Shelley. Yes, the Center for Excellence in Collaborative Education is, we've gone all digital for this poster presentation. We're pretty excited about the results. I just want to tell you a little bit about why all of these posters have been created, and it's because these students are working toward the honors distinction recognition upon graduation. The honors distinction is a way to recognize extracurricular activity that is interprofessional, and in order to earn the honors distinction, you need to attend 3 or more of our events that typically fell on Wednesdays between 12 and 1:30. And then you need to participate in a group project where the group develops a presentation from that project. And many students, we have over 80 students who will be getting the honors distinction this spring. We have over 80 students who will be getting the honors distinction upon graduation this spring. And behind each of those students is a fantastic faculty mentor who sees them through the process. Part of earning the honors distinction, as I mentioned, was attending the events, and those often happen on the Portland campus, but they're also live streamed to the Biddeford campus, where Michelle is often the hostess for those, and we're very happy to be on the Biddeford campus. Michelle, you want to talk about that a little bit?
Sure. So as part of the honors distinction process is attending events, as Chris mentioned, and this year we've expanded into bringing several events and programming to both campuses. So we've had not only Portland events live streamed to Biddeford, but we are also hosting events on Biddeford campus. We've had strong attendance of both graduate and undergraduate professions from across all the colleges. And our events have allowed these students to learn about, with, and from each other. We also wanted to add, if you're tuning into this live on the live stream feed, feel free to tune in to our Facebook Live, where you can add questions and comments and view individual posters in the photo gallery.
Thank you. So the way that this will work today is that we're going to work our way through several classes of posters. So we're starting out with the Interprofessional Student Advisory Team, which is the student group that's associated with the Center for Excellence in Collaborative Education and the project that they worked on this year. And then we'll move on to the Interprofessional Team Immersion, known as IPTE. There are 8 teams in the Team Immersion, and they've all done a poster or presentation of some kind. During that time, we'll announce the Dallaire Scholarship winners, of which there are 2, and the faculty team who will be awarded the M. Lisa Pegnuco Faculty Service Award. And then we'll see some posters from SBIRT, which is Screening, Brief Intervention, and Referral for Treatment for Substance Use Disorders. We have 2 posters from the SBIRT Student Leader Program to share with you. Then we have service learning posters. We have mini grant projects that have been completed in the community, and we have some presentations from the Mercy Pain Clinic. So we look forward to checking in with you throughout the length of the event. We're so glad to have you with us and glad to be able to present this fantastic work from all of our students.
Stop the Bleed is a national awareness campaign that was introduced by the White House in 2015 in response to the horrific mass shooting that occurred at Sandy Hook Elementary School in 2012. The cultivating idea behind the campaign was that no matter how fast emergency personnel arrive at a scene, bystanders are always there first and should be equipped with the skills and knowledge to temporarily stop an individual from bleeding until more adequately trained emergency services arrive. In 2019, an interprofessional team of student instructors conducted a training session at UNE. There, 46 students were trained with the skills necessary in stopping a bleed and potentially saving a life. As you'll see in the graph on the bottom left of the poster, many of the students participated in a survey to assess their level of comfort with tourniquet use and wound packing, both before and after participating in this training. Though not every student submitted a pre- and/or post-survey, the results of those who did indicate a significant increase in level of comfort with both tourniquet use and wound packing after completing the training. This information is useful as we move forward and plan future training events at UNE. Our hope is to see the training expand to all members of the local public, as well as a community of students, faculty, and staff at UNE. By engaging the public, we are able to provide more people of various demographics, backgrounds, and knowledge of emergency procedures with the skills necessary to save a life. Stop the Bleed provides us with the opportunity to work and learn in teams across professions to become informed and empowered to transform bystanders to upstanders with the potential to save lives.
In our interprofessional education final presentation, my group and I decided to focus our efforts on the role of occupational and physical therapy in burn and wound care. The specific aims of our project were to gain a better understanding of each other's professional roles and scope of practice, specifically pertaining to burn and wound care. It is hoped that this will help foster better collaboration skills and practice and promote a more welcoming environment to ask questions about each other's professions. Between the 3 of us, we have had at least some form of education or hands-on clinical experience in burn and wound care, and wanted to further highlight this area of practice so that others realize that multiple professions can work together to help treat this specific population. We also included information on how physical and occupational therapists can get certified in burn and wound care in order to further advocate for the scope of each of our profession's practice areas. On this slide here, you will see a link to our presentation, and we hope that you check it out. Thank you.
Hi, my name is Casey Emilio. I'm a first-year OT student at UNE. This past semester, I participated in IPTE, Interprofessional Team Immersion. My team members are Jessica Stewart, PA, Cami McComber, Nursing, Janet Labrich, DO, Nicholas Schellenberger, Social Work, Leah Martin, Pharmacy, and Kathleen Broussard, Dental Hygiene. Our client was Alex, who was presenting with a lot of physical ailments, including stomach pain, a cough, teeth pain, and also was dealing with homelessness, unemployment, and many mental health challenges. So you can see how the large array of students with many different skill sets really came in handy with this specific client. Our poster represents what we all took away the most from this experience, although we learned so much about how to work with Alex through teamwork and trial and error and just being with that many students on one client. It was really all about what we learned about each other and our professions, whether that be differentiating the role between PA and DO or social work and occupational therapy, understanding that dental hygiene is more than cleaning teeth. It was all about patient education for our client. or that nursing was this incredible support for every single member of the team due to her vast array of knowledge, and pharmacy, who Leah brought something completely different to the table and was looking at Alex in a way that none of us were. So it was really great working with this many students, and we can all definitely say we feel so much more comfortable working on an interprofessional team in the future, and we'll look back on this as a super enriching experience. Also, a special thank you to Dr. Prichard from Social Work and Dr. Landon Padavina from Occupational Therapy for being our faculty advisors, and our student facilitator, Samantha Gillenwater from Occupational Therapy. Thank you.
Hi, I'm Julia Bazaire. I'm a second-year pharmacy student at the University of New England. I got the privilege to work alongside Brianna Fitzgerald, who's a dental hygiene student, Heather Putnam, who's a social work student, Allie Ross, who's an OT student, Shannon Yu, who's an osteopathic medicine student, and Hadley Warner, who's a PA student. We did a poster presentation regarding our IPD experience. Our research question was, how is collaboration essential or vital to patient-centered care? So as a team, we created various questions regarding our IPD experience, and then each team member answered the questions in an anonymous survey. We took the responses and questions to show how the IPD experience and the interprofessional skills that we gained can help us in our future practices and optimize the care we deliver to patients. We also included actor feedback to add a patient perspective. So a few things that really resonated with us and things that we think proved what we gained from the experience was, I'll give a summary and direct quote. So one question that we included in the survey was, what lessons would you take away from your IPD experience? A response we included was, each profession has its own expertise. Knowing everyone's roles and responsibilities can help you optimize your healthcare team. I think this is really important because as a pharmacy student, I may not have been able to be the best option for Alex in this case because I don't have all the access to resources and other things that social work has. So I was able to step back and see what social work could do, and I think that role fit more and made more sense to help this patient in the best way that we could as a team. In addition, one thing I think to include about the actors' responses, they touched on the fact that one of the first things we said in our first session with Alex was asking what pronouns that they would prefer us to address them with. This is something that our team both struggled with but also respected at the same time. It was just a matter of getting used to it, and I think as a team we really came together with correcting each other and ensuring that we respected the patient to the utmost of our ability. So that is Team Alex's poster presentation on addressing Alex from a dynamic team approach. Thank you.
Hi. Being homeless and unemployed can have a very detrimental effect on your mental and physical health. It also can interfere with being able to have access to medical care. In the initiative Housing First, the main premise is that your emotional, physical, and medical health cannot be complete without having the security of a home. In this team immersion, we explore how finding Alex a home builds a foundation for further care for her mind and her body. My name is Michael Harris. I'm in the MSW program, and my role was as the social worker. My team members are Jay Jaganathan, DO candidate, Michelle Morales, DMD candidate, and Alyssa White, PharmD candidate. We also worked with Valerie Jones from the MSW program, as well as Ian Empert from IPD as our faculty mentors. And our patient was Alex Simpson, and this was part of the Center for Excellence in Collaborative Education. Our main objective was how to best prioritize and provide care through an interprofessional lens for an uninsured patient with multiple health needs. Alex had some serious concerns that needed a closer look, from periodontal disease to high anxiety. There was a lot to look at. So we stressed the importance of enabling her to get main care. That happened, and we found that a big piece of her own mental health was that housing. So when she received housing, this opened her up to other medical treatments, and it was really a balancing act of what needed most attention at the time. So to work as a team, it's important to understand what each member brings to the table. Before our meetings, we clarified our roles, and that helped us delegate responsibilities according to our strengths and the patient's needs. I was a social worker and was responsible for helping Alex get housing and main care. The pharmacist was responsible for recommending medications that were accessible through the government program. So we really explored everyone's priorities and goals within the group and established some guidelines. And these guidelines help create a psychological safety net to discuss ideas openly without any fear or apprehension.
The Center for Excellence in Collaborative Education is lucky enough to have an outside donor that helps to fund some of the activities that we bring to the students. That donor is Brian K. Dallaire, and his wife, Deborah, have made a gift for the last few years that helps to support our mini grant program and also a leadership scholarship, which we are able to give to 2 students per year. So this year we are able again to award that scholarship to 2 very deserving students who have been active in IPE and have been great interprofessional scholars. And we have invited faculty from their programs to come and announce their scholarships for you. So I'm happy to introduce Amy Litterini from Physical Therapy and Emily Dornblaser from Pharmacy.
So, hi, my name is Amy Litterini, and I am a member of the PT department faculty, and it is my distinct pleasure to announce a recipient of the Dallaire Interprofessional Leadership Scholarship, Donnie Yatanis. Donnie is a student in our PT program who has had many accolades for leadership and scholarship over the last few years. She was involved with IPTE as well as on the team that won the Clarion competition. She's a CUP scholar. She has been part of the Pine Tree Recovery Center project, including the needs assessment and ongoing collaboration with their clients with substance use disorder. She was a member of the pilot program who became certified volunteers for Compasses Hospice and piloted the Celebrate Life program with their clients on hospice. She has done service for the Cumberland County Jail Project. She's taken 3 elective courses this semester, 2 of which have posters today at the symposium. Another submission went to the Governor Mills Opioid Summit. She was accepted to do a poster and a podium presentation for the Northern New England Clinical Oncology Society Conference, a tri-state oncology society. And she's also a dedicated volunteer for our department and the college through admissions. She's also a graduate assistant for us this fall. And she does everything that she does with a smile and a positive attitude. So it is my distinct honor and privilege to get to work with her. And I'm just so happy for her. So thank you.
Hi, my name is Emily Dornblaser. I'm the Assistant Dean of Interprofessional Education at the College of Pharmacy. Today, it's my distinct honor to announce one of the winners of the Dallaire Interprofessional Leadership Scholarship. And I'm thrilled to announce that it is our current P2, Sandra Scipoletti. I've had the opportunity to facilitate Sandra's IPTE team when she joined as a P1 with very little pharmacy background. And I was absolutely blown away by her compassion and holistic approach to the patient, as well as her dedication to track down pharmacy answers for her team, despite not having the disease state knowledge as a background. I was truly a little worried to have a P1 start in IPTE, and she just proved me absolutely wrong every step of the way, and I could not have been more excited to have had her there to represent our profession. During her team interactions, she displayed a natural comfort with validating others' perspectives and working with the team to achieve shared goals. She's taken that experience now, and she's turning it into effective leadership skills. She serves as the IPTE student coordinator this year. She organizes IPTE events for the Center of Excellence in Collaborative Education and is at each event to anticipate challenges and ensure that things are running smoothly. I could not be more proud or impressed by her leadership skills at this point in her career. She still has another didactic year to go, and I cannot wait to see what comes of it. She's already contributed so much to the mission of IPE at the College of Pharmacy. Having a student leader engaged with IPTE has increased our student engagement with the event, and I have more students than ever approach me about pursuing IPE honors badge or honors distinction. And it is my true pleasure to announce that Sandra is the winner of this award.
Hi, welcome to our poster where we looked at vulnerability through an interprofessional lens. My name is Sarah Robertson, and this poster includes perspectives from myself, a physician assistant student, as well as Stephanie Hill, a pharmacist student, Rebecca Jeanette, a dental hygiene student, Haley McCoster, an occupational therapist student, as well as Julie Petit, a student of physical therapy. We were very humbled by this experience throughout meeting Alex. Vulnerability was the common thread we saw throughout each of our experiences, and we thought it was worthwhile to share. Alex surprised us all with her immediate needs being very different than we had all expected. Initially, we were taken back by her complaints of neck pain, difficulty eating, vertigo, ringing in her ears, as well as a past medical history of periodontal disease. It was not those complaints that needed attention, however, it was the deeper issues underlying those. For example, she was having difficulty eating, but the bigger question was, did she have access to food? And did she have access to enough food? And her neck pain actually happened to be associated with her living situation. So as we discovered these deeper issues, we knew right away that occupational therapy and social work would be the primary role in Alex's care. And it was from here where we really started to understand who Alex was and what her needs were through the help of occupational therapy and social work. We want to thank you, everyone that participated in helping us learn and grow together. And a special acknowledgement and thank you to our faculty who supported us and encouraged us along the way, Stacey Thiem and Dana Laham, as well as thank you to Bora Park and Allison and Engelhardt. And most of all, thank you to Alex and Bob who took their time to do this. And we're really grateful that you were part of this experience with us, and a truly unforgettable experience. Thank you so much.
Using a patient-centered approach and valuing collaboration with our patients themselves contributes to more positive healthcare experiences. Hi, my name is Brianna Haley, Master of Social Work student 2021. In spring of 2020's Interprofessional Team Immersion experience, I was in the role of the health clinic's social worker. Our team consisted of Brandon Hazelton from the College of Dental Medicine, Rachel McKinney, occupational therapy student, and Lisa Rosen, physical therapy student. Our faculty members were Dr. Elizabeth Crampsey, Dr. Emily Dornblaser, and Dana Vilmore. Our objective was to work collaboratively with each other to treat our patient Alex for her various health concerns. Our team quickly realized that each member had valuable knowledge that we could employ to help Alex have a positive health outcome after this clinical experience. Navigating how to work collaboratively was certainly challenging, especially knowing that each of us had Alex's best interest at heart. Our team discovered that by putting the client's needs and perspectives at the forefront of our care, it led to greater confidence in us from our patient. This experience helped us to realize that healthcare really is better together.
The title of our poster is Together We Stand, Divided We Fall, Formulating an Interprofessional Care Plan for Alex Simpson. Our objective is utilizing interprofessional team immersion to develop interprofessional skills among other healthcare professions to plan for the best course of action for our patient Alex Simpson. We assess that her oral pain is due to previously diagnosed HSV-1 infection. Her living situation is a lack of stable housing, mental health. We had asked about her mental health and possible suicidal thoughts due to her depression, hopelessness, and anxiety. Main care was brought up as she was currently under no health insurance plan. Our plan during that first visit was to continue the full dose of valcyclovir and advise the patient on proper dosing instructions and not splitting her tablets the way that she was. We provided patient education on the guidance on main care enrollment, and our follow-up was to be scheduled in the next 2 weeks. In our second visit with Alex, we addressed her main care enrollment concerns. Her friend Bobby had attended the meeting with her, the appointment with her, to express concerns about Alex's alcohol use and wanted to know how to help. During this plan, we provided her with dental cleaning kit, including toothbrush and toothpaste, and addressed how she can properly take care of her teeth. And we educated her on local job fairs, bus lines, food programs, dental resources, and discussed the benefit programs associated with main care, addressing all of her questions and concerns, as well as Bobby's. Our patient was referred from the dental office, and so dental issues were assumed to be the chief complaint. But the more we spoke to our patient, higher priority concerns became more apparent during the first meeting, so the focus was shifted. During the first meeting, however, Alex was reassured that the dental pain could be eased and we would follow up with the next meeting. During the second meeting, a discussion of the importance of oral health and its connection to the body were reviewed. and resources were made available to Alex in order to establish a regular site for care.
Okay. So in 2015, when we were the Interprofessional Education Collaborative, we initiated a faculty award. The faculty award went to a faculty member who had shown really extraordinary activity and interest and motivation to promote interprofessional education. The first award was given to Lisa Pagnucco from the College of Pharmacy, who was the first to bring the Clarion to the campus and also did so much to start IPSAT, our student-based interprofessional team. We subsequently named the faculty award the M. Lisa Pagnucco Award after Lisa being the first recipient. So today I'm very excited to present this award to the Parallel Process faculty team for their tenacity and staying power and their vision that they have sustained now for quite a long time. And I'm going to read the names of all of the faculty who please stand up when I present this to you. Jan Froelich, Sally McCormick-Tutt, Liz Cramsey, Valerie Jones, Carol Lambden-Padavina, Kira Rodriguez, Nancy Jo Ross, Diane Visich, Aaliyah Sullivan, Tara Parody, Kelly Fox, and Leslie Oakes. It began in 2013, so for 7 great years, these folks have been bringing Parallel Process to students in the summertime. They have done 6 local, national, and international presentations about this process, and they're currently in collaboration with Rosalind Franklin. Thank you so much, Parallel Process team, and we applaud you. Thank you, and congratulations.
How do we understand interdisciplinary teams? Or better yet, how do we analyze the distinct strengths that each professional brings to a group that both enhance and encourage a dynamic interplay of team roles? My name is Emma Canducci, Occupational Therapy Class of 2020. My team members included David Bach of Osteopathic Medicine, Bailey D'Antonio of Physician's Assistant, Vanessa Dufford of Social Work, Marissa Paquette from Physical Therapy, and Jonathan Wormers from Dental Medicine. We worked together as the Storming Sea Otters in IPTI. Our primary goal in developing a project was to better understand how our unique abilities complemented and enhanced our ability to function as a client-centered team. Through the use of the intentional relationship model, we learned about our natural strengths and then analyzed our interactions, both within our team meetings and with our patient. What we found is that our team flourished when we took time to listen to one another, to use each other's strengths, and maintain our patient as our primary focus. We hope that you enjoy our project, Understanding an Interprofessional Team through the lens of the intentional relationship model.
Everyone, my name is Kristen Gordon, and I am presenting the interprofessional poster on behalf of my teammates. My teammates were Trevor Branch, who is in the Accelerated Nursing program. I'm Kristen Gordon in the Dental Hygiene program. Jennifer Hammond is in the College of Pharmacy. Stephanie Hardy is in the Physician's Assistant program. Jordan Sanders is in the Occupational Therapy program. And Hope Turner is in the College of Osteopathic Medicine. Our research question was, do simulated interprofessional client encounters impact the likelihood and confidence of future healthcare professionals to work interprofessionally in practice? We were given a case study named Alex. He was 20 years old. He had a turbulent family history and was homeless and unemployed. He came to us for GI upset as well as oral pain. We were given 2 days of simulation to work with Alex as well as debriefing time. And in our time working together, we were able to develop a better understanding of each team member's general role and responsibilities, and were able to note similarities as well as differences among the professions. And in doing so, we were able to come up with an individualized approach to Alex and give him the most comprehensive care possible. And our results from the experience, in the bottom section of our poster, we listed quotes from each team member And we all talked about how we were more confident in working with one another, as well as being able to apply it to how we were going to work in healthcare in the future. So this whole experience, we would like to thank the UNE Collaborative, as well as our facilitators, Franklin Brooks and Mary Obie, for helping us through this process, because we found that we're going to be more likely to utilize interprofessionalism in our everyday lives now that we have been able to work through the conflicts that may arise and are able to understand what everyone does in their professions. So we are better equipped to be able to call onto the right professions to help us in patient care. So without this experience, we would still be lacking this knowledge of how we can better serve our patients.
Good afternoon, everyone. My name is Clay Graybeal, and I'm on the faculty of the School of Social Work, and I also direct the SBIRT grant program. And SBIRT stands for Screening, Brief Intervention, and Referral for Treatment. And our focus is on harm reduction among substance use and substance use disorders. This is a method for helping individuals from all of the various health professions to know how to identify concerns having to do with substance use. We are very pleased that we are training students in 9 different health professions here at UNE. It's perhaps the most in the country, so far as we know. We're proud of that. And we're very pleased to have a couple of presentations of posters as part of today's event. And particularly that one of ours is from the Biddeford campus and led by Bethany Fortier, one of our outstanding faculty. So we hope you have a great day, and we look forward to your feedback. Thank you.
Hi, my name is James McClay, and I'm a final year student in the social work program. I worked alongside Nicole Blake from the social work program and Masim Amin from the occupational therapy program. Our faculty mentors were Clay Graybill from social work and Jane Froelich from occupational therapy. Myself, Nicole, and Masim completed the SBIRT leadership program. And for our final project, we did a poster which aims to demonstrate the value SBIRT provides to a wide range of health professions. The method to promote the implementation of SBIRT across settings will be to look at 4 core competencies of collaborative practice outlined in Core Competencies for Interprofessional Collaborative Practice 2016. So we entitled our poster SBIRT, the No Wrong Door Approach, and we asked the question, who does SBIRT belong to? So for those of you that are not familiar with SBIRT, it stands for Screening, Brief Intervention, and Referral to Treatment. It's a comprehensive, integrated public health approach for early identification and intervention with patients whose patterns of alcohol and or drug use put their health at risk. So we looked at the 4 competencies. Competency 1, values and ethics for interprofessional practice. Competency 2, roles and responsibilities. Competency 3, interprofessional communication. Competency 4, teams and teamwork. And if you read through each of those competencies on the poster, I think the question is pretty clearly answered, that SBIRT doesn't belong to anybody in particular, and in fact it's a fantastic tool that can be used by various health professionals and community members alike, as stated in competency 3. We'd like to acknowledge the SBIRT leadership program advisors Clay Graybill and Chris Hall, the program manager, and also Jane Froelich from the occupational therapy school. Thank you.
My name is Shannon Keevy, and I'm here to talk to you about the importance of SBIRT training in undergraduate curriculum. Our research question is, what is the significance of screening, brief intervention, and referral to treatment, also known as SBIRT, and why is it important to implement in undergraduate curriculum? Many adults experience both a substance use and alcohol use disorder. Excessive substance use can lead to short-term and long-term health complications and risky behaviors. SBIRT maximizes efficiency and minimizes costs by providing a wide range of services, including less intensive services, to meet the needs of individuals at each point along the substance use continuum. SBIRT is a comprehensive, integrated public health approach to the delivery of prevention and early intervention for persons who may be at risk of substance use disorder or who currently have one. It is comprised of screening, to quickly assess current substance use, brief intervention, to focus on increasing insight and awareness regarding substance use and motivation towards behavior change, and referral to treatment, to provide those identified as needing more intensive treatment with access to care. Our training highlights were that we were able to work in interdisciplinary teams and discuss potential situations and role play. We interacted in live situations to practice motivational interviewing with patient actors and learn how to build rapport within these live situations. We were challenged to be flexible with our thinking by omitting information prior to role play, leaving us confident with our skills. We worked with different disciplinary practices such as osteopathic medicine, dental hygiene, and dental medicine. We received guidance and constructive criticism, and we became familiar with screening procedures and tools such as the audit screening tool and the readiness ruler. Our takeaways were that overall, substance use disorder is a public health issue rather than an individual's personal failing. It is essential to recognize individuals who have a substance use disorder and learn how to apply the knowledge we've learned in our undergraduate studies, such as motivational interviewing, preventative care, and to practice these skills in real time. The importance of enhancing and promoting preventative care, and learning to be adaptable. Learning to see each client as an individual and base your treatment plan around their needs, and learning how to seek out clients' future goals and use them as a motivating factor. The importance of interprofessional practice was our greatest takeaway. The ability to work and collaborate with healthcare practitioners from a variety of specialties and see different viewpoints on assessment and treatments. Communication and teamwork were key. Future implications for occupational therapy are that OTs examine clients' behaviors and habits and try to build or rebuild occupational roles that were meaningful to them. Implications for public health are youth in schools, implementing preventative measures and screening at a young age, and insisting on insurance funding. If it is viewed as a more public health issue, more funding will be allowed. SBIRT should be considered a public health initiative designed to reduce population rates of substance-related problems. General healthcare implications are combating stigma in medical fields and by training providers, understanding the unique factors that influence individuals to become more empathetic and compassionate. Our recommendation are to incorporate motivational interviewing and SBIRT training into the coursework of all healthcare professionals. Begin screening at an early age. Baseline for those are at a higher risk, and early onset is a risk factor. Implement preventative measures in schools, recognizing signs for at-risk behaviors and providing a risk of resources for those to access at any age. As practitioners, using motivational interviewing during situations where substance use poses specific threats to a person's capacity for health maintenance. A barrier to implementing SBIRT is lack of funding. We hope that we can use our training and our future endeavors as healthcare professionals. Thank you.
Hello, my name is Trisha Mason. I am the Director of Service Learning in the Westbrook College of Health Professions. I work with students and faculty across the university. Together with our diverse and inspiring community partners, students work as interprofessional teams on mutually beneficial service projects. Some might take place regularly throughout the semester, such as our mentoring program with Deering High School, or our wellness program with inmates at the Cumberland County Jail. Others might be one or two opportunities that students take advantage of throughout the semester, such as our foot clinics at the Milestone Recovery Center, or our Wild and Wonderful Festival with the members of the Boys and Girls Club in Portland. Students from nearly all professions come together to plan and implement these projects, bringing to bear each of their strengths and unique skills from their individual disciplines. Students can choose from a variety of service learning activities, working within diverse community settings and often with vulnerable populations within our community. So we look forward to working with you and promoting service learning and interprofessionality within our communities.
Good afternoon. My name is Curtis Warren. I'm a second-year DPT student. I'm here to present an innovative collaboration of an academic institution with a community recovery center with my co-authors, Sydney Charles, Jennifer Ritchie, Julie Sullivan, Nathaniel Witten, Donnie Atenes, Brian Ruby, and under faculty, DPT, Amy Litterini. In the summer of 2019, a group of service learning volunteers from the University of New England worked together to create a needs assessment to administer in the intensive outpatient program at Pine Tree Recovery Center. This spring in PTH 799, an elective second-year PT course, a group of students worked to use the data from the needs assessment to create 3 interactive IOP sessions for the programming at Pine Tree Recovery. The first of which focused on breathing and trigger point release tactics for relaxation purposes. The second focused on postural awareness and home exercise programming based on evidence-based recommendations. And the third focused on local, low-cost outdoor recreation activities in hopes to use these new relaxation techniques and exercise mindedness to get out and be active. In the future, we hope to present these sessions electronically to the IOP population at Pine Tree and hopefully to Liberty Bay Community Recovery Center. And we hope that this collaborative bridge remains open between the university and these two recovery centers. We would like to thank the pharmacological program at UNE and the social work program for helping us in the classroom, and Pine Tree Recovery Center and Liberty Bay Recovery Center for helping us outside the classroom. Thank you. Have a nice day.
Hi, my name is Madison Kirchner, and I'm a first-year occupational therapy student. Our group consisted of 9 occupational therapy students: Avery Abagini, Emma Shabat, Abigail Higgins, Laura Gerard, Megan LeBlanc, Emily Spencer, Alyssa Germanos, and Haley Ruth, who were mentored by Professor Folick, and 1 social work student, Carly McKenna, who was mentored by Professor Brooks. For our project, we worked with Long Creek Youth Development Center's new transitional house known as the Bearings House. The Bearings House is a transitional program that helps the residents gain skills for reintegrating back into the community in a supported setting. Our mission for this project was to explore their interests and expose them to new occupations that will help them be successful with reintegrating back into the community. There was a total of 4 residents that lived in the Bearings House and took part in this project. On our first meeting, we provided them a needs assessment in the form of an interest checklist to get a better sense of how to individualize the sessions based on their individual interests and or need areas. We split up into groups of 2 or 3 and coordinated with the Bearings House on times when we could meet, and as individual groups, we went to the Bearings House 4 times a week in 1 to 2 hour sessions for a total of 9 sessions. During the sessions, we played budgeting games to introduce them to financial management. We created vision boards to increase self-identity and goals, introduced them to coping strategies, and also just hung out and played cards to get to know them a little better and build rapport. Our project unfortunately came to an abrupt end due to COVID-19. The University of New England terminated site-based projects, and Long Creek Youth Development Center also reduced non-essential people inside all of their buildings. However, our short time spent with the residents was filled with helping them develop routines, identify ways to fill in structured time, and address mental health goals, which will provide the residents with the tools they need for future transition to community living. Thank you so much.
This poster discusses our project, Medication-Assisted Treatment Education Program at the Cumberland County Jail, presented by Jasmine Edwards, Kristen Gallagher, and Ariana Parent of the Physician Assistant Program, and Kristen DeMeo of the College of Osteopathic Medicine. Our goal is to improve perceptions of SUD and expand knowledge on the use of MAT in corrections officers at the CCJ. Substance use disorder, or SUD, is a major issue in the U.S. Medication-assisted treatment, or MAT, is an evidence-based and effective method of response to this crisis, yet it is underutilized.
The Cumberland County Jail has started an MAT program for inmates. Through an educational program created by UNE Health Professions students, we hope to improve the CO's general knowledge and attitudes about SUD and MAT. Unfortunately, due to COVID-19, we had to postpone the delivery of our educational series. We are hopeful that students will be able to continue our mission in summer or fall 2020.
Our evidence-based curriculum was developed by an interprofessional student team with input from UNE faculty and community health specialists. The curriculum consists of 2 10-minute PowerPoint presentations. The first presentation will address SUD and SUD stigma. The second will cover the medications used in MAT, as well as common misconceptions surrounding MAT. Figures 2 and 3 are from the SUD and stigma presentation. Each session will offer free food and raffle tickets for prizes. We will also be administering a voluntary anonymous pre-post survey to the CEOs who have attended both presentations. The survey will ask participants to reflect on their perceptions before completing the curriculum and if or how they have changed.
When the curriculum is presented, we will administer pre- and post surveys modeled after the one below. Change in attitudes about substance use disorder and medication-assisted treatment will be assessed. We hope that reducing stigma about SUD and MAT can help create a safer environment for inmates and improve the efficacy of the MAT program at the Cumberland County Jail.
Hello, my name is Crystal Clendenin Pierce, and I'm a second-year osteopathic medical student here at the University of New England. I was the president of the American Osteopathic Association of Addiction Medicine student chapter here at UNE, and under the direction of Dr. Victoria Stacy Feeney, I had the opportunity and pleasure to organize and attend the E-Gala event that took place last fall. E-Gala stands for Equine Assisted Growth and Learning Association, and it's a nonprofit organization that specializes in the use of horses in teaching leadership and team building through problem solving and metaphors. Horses are a prey animal, so they're very attuned to emotional cues and changes in body language, and their size makes them impossible to ignore or force them to do anything they don't want to do. This experience helped me to see that my future colleagues have their own amazing talents and excellent insight, and if I will allow them to help, together with our patients, we can be the best team to keep our patients healthy in mind, body, and spirit. This experience was unlike any other I've had at UNE, and my favorite part was collaborating with the team to solve problems posed to us by a certified clinician and an E-Gala equine specialist. And sometimes we literally had to lean on each other to get through the scenarios which were presented. The reflections that my colleagues proposed after each session were astounding, and I was surprised at how well the metaphors lent to a very profound and meaningful learning experience. I hope this experience is made available to more people. During my first year of medical school, the event was canceled. But this year, we were able to get funding through a mini grant with the Center for Excellence in Collaborative Education. I am so grateful and happy to have been able to learn with E-Gala.
Hi, my name is Erin McCormick, and I am an MSW student that worked with OT students Gabriella Tamusic and Olivia Riding under the guidance of Dr. Kristen Winston, our faculty advisor. For our IPEC mini-grant project, Caring for Caregivers of a Loved One with ALS, the goal was to supply caregivers that attended the ALS Family Caregiver Lab with a care package. This care package provided tools and resources to help relieve stress and ease the burden that caregivers may be experiencing by promoting self-care. 15 packages were distributed after the facilitation of an all-day workshop on November 16, 2019. Each recipient was sent home with a survey that was to be sent back a month later to provide feedback about the contents. The burden placed on caregivers is significant and has impacts on emotional, mental, and physical health. The ability to provide care packages to caregivers of a loved one with ALS was truly a meaningful experience. From the results that we obtained from the one participant that returned their post-survey, the care package was 92% helpful in some way, and participants of an ALS caregiver support group expressed gratitude for being thought of. The project would have benefited from a longer timeline to complete the project application process and gain approval from the IPEC board. Also, a pre-survey given to participants to gain a greater knowledge of participants' interests to make the care package more client-centered would have improved the project outcomes. Additionally, making the care packages more inclusive for male and younger caregivers, determining how much time caregivers take for themselves, providing caregivers with education and rationale of each item, and collecting data through an online survey afterwards would have been helpful. Overall, it was a beneficial experience to work on an interdisciplinary team as we all brought unique and diverse perspectives.
Between April and August 2019, over 400 asylum seekers arrived from San Antonio, Texas to Portland, Maine with less than 3 days' notice. As an interprofessional team, we collaborated with each other and with community partners to create and establish a community-based project facing many barriers and challenges that we did not originally anticipate.
As an interprofessional group, we created a student-led mini-grant. Our group members included 2 second-year social work students, Becca and Jen, and 3 first-year occupational therapy students, Alyssa, Olivia, and Alina. Our faculty mentors included Professor Jan Froelich from Occupational Therapy and Professor Carol Landon-Padavina, also from Occupational Therapy, and Arabella Perez from Social Work. We also feature the community partners we worked with throughout this process on our board.
Although we were never able to reach the conclusion of our project, our group of OT and social work students were able to learn valuable lessons in discovering, acknowledging, and overcoming barriers and challenges in designing an interprofessional project with community partners.
Some of the interprofessional competencies we used during this project allowed us to explore and address the challenges that we came across. In terms of collaborative leadership, we each needed to embody a leadership role and fulfill responsibilities that worked to each of our own strengths and skills. We determined what our roles as students would be in providing services to the asylum-seeking community. Further, we learned about productive communication while working within a large team of different academic, professional, and experiential backgrounds, whether that was deciding what technology platforms to use or which communication styles worked best to garner buy-in and motivation.
Additionally, we also explored the ethics of what we could do as students sustainably, not for this project only, but throughout the years, and what we could do with competency, using the tools, knowledge, and time that we had. We maintained a consistent check-in with our group in order to explore our motivations and values surrounding this project, and we strove to match these values to those of the population we were going to serve. Although there has been disruption due to the global pandemic, we are eager to see this model of cultural ally training put into action in the future, and we thank you for viewing our cultural training poster as well as listening to our group. Thank you.
Hi there, my name is Emily Kruger. I'm a Master of Social Work student and will graduate this May. I created this presentation as an assignment for my seminar class. The objective was to present an ethics topic to my internship placement. My placement was at the UNE Oral Health Center. I am the first social work student to have a role at the Oral Health Center, and the full presentation outlines what I was able to accomplish. In this short presentation, I will outline the process of collaboration that was used between myself and the dental students at the Oral Health Center. Please also take a look at my final video presentation, which is about 25 minutes long. This general process of collaboration that was used between dental students and myself throughout my time as an intern is as follows. Number 1, the student dentist or I see the need for collaborative treatment. Number 2, we would share our different lenses, perspectives, approaches, and ideas. I, as the social worker, would advocate for the social justice lens and perspective, and the student dentist would advocate with the goal of treatment and or the oral health concerns in mind. Number 3, we would then take action together to create a positive and successful dental appointment for the patient. Number 4, after the appointment, the student and I would debrief about how the appointment went, what could have gone better, or what went well. Lastly, is the wraparound, or the process of creating a plan for the future. This would happen with the student dentist, the patient, and I while the patient was still in the chair, and then again with just the student dentist and I after the appointment was completed. This not only completes the quote-unquote circle of treatment, but it is also the most important part of interprofessional collaboration. Please see the following link for the full-length presentation.
Hello, everyone. I'm Ling Chao, a faculty member in the Department of Biomedical Sciences in the College of Osteopathic Medicine at the UNE. The Interprofessional Student Pain Clinic Program at Mercy, or many of you call it a Mercy Pain Program, was established in 2016. So far, we have had over 100 students participate from 7 different professional programs at UNE. Each team would work with one newly referred patient at the pain center. With the supervision of Dr. Hall, student team would conduct interviews, observe physical examinations, discuss the treatment plans, and for many cases, they have opportunity to see the result of some of the suggested treatment. The team meet patient 3 times in person and meet among themselves 4 times throughout the semester. At the end of the program, students from each team will share their experience with the UNE community at the IPAC poster event.
Our project is Group 17 IPE Pain Conference with UNE students of the Colleges of Pharmacy, Physical Therapy, Social Work, and Osteopathic Medicine. presented by Beatrice Byrne, Michael Cornea, Rebecca Durant, Abigail Gomo, Madison Lostra, Vanessa McCoy, and Fanny Wabwende, supervised by Ling Sao and Stephen Hall. Chronic pain is a serious health problem that continues to grow. Due to limited education on pain management, many practitioners are not equipped to deal with it. Fortunately, the Mercy Pain Clinic hosts a program for health professional students and teaches them the types of pain, the pathology, and the impact on the patient. We would meet before and after each patient meeting, in addition to meeting with the patient, to collaborate and develop a plan that adheres to the patient's needs and goals. So the big question for these students is, what skills are you taking from this experience into your future practice? From the social work perspective, it was very validating to hear compassion from all disciplines and understanding that pain is real, with or without physical explanation. I have gained confidence and competence using acceptance and commitment therapy, particularly regarding acceptance of chronic pain. One thing I will take into my practice is requesting ongoing interprofessional collaboration with providers identified by my client.
From the osteopathic medicine perspective, being a member of this team has demonstrated that a multidisciplinary approach to pain care allows for the creation of a truly patient-centered treatment plan. When all perspectives are given equal opportunity to weigh in on a case, the patient yields the most choice and therefore control in the process of managing chronic pain. Complex cases like chronic pain deserve creative approaches. As a future physician, I look forward to being able to lean on the support of the disciplines in this group to help our patients achieve their goals of better health.
From the physical therapy perspective, this program certainly highlighted the importance of the role of physical therapy for the care of patients with chronic pain. However, physical therapy is not the only intervention that these patients rely on to manage their pain. There is care being provided by a variety of health professions that help manage all angles of patient care. The physical therapy interventions need to be provided with the consideration of those other treatments and the timing of that care. This clinic has demonstrated the importance of communication between each member of the patient care team to ensure appropriate and effective treatment.
So from a pharmacy perspective, firstly, I enjoyed this program, and I believe that it really helped me become more prepared for future interprofessional collaborations. The patient that we had was looking for a more holistic approach in managing her pain, so she was not interested in trying out new medications, which is completely understandable. So this made me realize that drugs are not always the cure or the answer to a problem. And it also helped me to rely on other professions, particularly physical therapy, and to trust their expertise.
The pain clinic approaches pain and treatment to pain with a hurt versus harm model. Our bodies produce pain or hurt when we are being harmed. Chronic pain occurs when the line between harm and hurt becomes blurred. Even though there's no harm coming to our bodies, in chronic pain, the body still thinks that it's being harmed, so it produces pain and hurts. COVID-19 has forced healthcare to adopt a similar model. Patients who are harmed or who will be harmed if they don't receive care are the only patients who are being seen right now, and patients who hurt, like our chronic pain patients, will not be seen in person because even though their bodies hurt, they're not being harmed.
Due to the progression of COVID-19, our patient, who is not currently experiencing harm despite her pain, is unable to receive in-person physical intervention. However, she does have the option of receiving telehealth interventions such as psychological intervention, which can be a very useful starting point for somebody looking to experience a holistic health approach. Telehealth is not limited only to healthcare provider and patient communication. It's also a useful tool for people of different medical disciplines to communicate amongst one another to create a holistic plan of care using interprofessional methods.
Hello, my name is Albert Allard, and today I'll be discussing our experience at the Supervised Interprofessional Student Pain Clinic overseen by Dr. Stephen Hall, Dr. Ling Sao, Professor Kelly Fox. We are an interprofessional team made up of Andrew Lee from the College of Medicine, Catherine Seabell from the College of Medicine, Holly Saros from the College of Physical Therapy, MacGyver Pullen from the College of Occupational Therapy, Amanda Garami from the College of Social Work, and Albert Allard from the College of Pharmacy. We are an interprofessional team assessing, treating, and monitoring a chronic pain patient over 3 patient visits. Some background information about our patient. She's a 75-year-old white female referred by a primary care physician for chronic back pain. The structure of our project. In our first meeting, we met everybody and discussed each of our professions. We also discussed the case. In our first patient visit, we made an assessment of where we thought her chronic pain was coming from. The second meeting was a summary of the patient visit, and we implemented a treatment plan. The second patient visit was talking to the patient about our treatment plan. In our third meeting, we summarized the second patient visit and her acceptance of our treatment plan. And then for our final meeting, it was a discussion from each profession and how we played a role into the case. For our assessment, a failed total hip arthroplasty, lumbar post-laminectomy syndrome, bilateral primary osteoarthritis of the knee, cervical spondylosis, and obesity all played a role in our chronic pain. Our treatment approach, we'd like to refer to an osteopath, refer to a physical therapist. She may be a candidate for a foot orthotic. We assess concerns relating to her pain medication, and then also she may be a candidate for pain psychology consultation. Notes from each profession the College of Medicine provided. They diagnose illness and injury. They use a holistic approach, meaning they treat a patient as a whole and not just the symptoms of injuries, and they can correct any structural problems to assist the body towards health. Pharmacy has the ability to assess medication profiles for any offending agents. They focus on medication safety, including drug-drug interactions and appropriateness, and they also guide pharmacotherapy. Physical therapists diagnose movement dysfunction. They educate on the performance of therapeutic exercise, and they provide in-home treatment options like exercises and stretches. Social work teaches skills and develop mechanisms for patients to cope with their current problems. They advocate for patients and their rights for proper care. They also recognize patient needs and locate services for them. Occupational therapists improve, regain, and develop the skills needed for day-to-day life and work. They help the patient function in all environments, and they assess needs for adaptive equipment. This experience allowed us to learn about other professions and their expertise. Treating patients with an interprofessional team allows us to provide the highest quality of care.
Hi, my name is Alex Joseph, and I'm a co-author for a literature review for prehabilitation interventions on outcomes for gastrointestinal cancers. My co-authors include Joseph Bogman, Kelsey Dumont, Samantha Gagne, Tai Ho, Donnie Yonitz, and our faculty advisor, Amy Glitterini. We are all DPT students that enroll in oncology course at UNE. I would like to acknowledge a collaboration with Dr. Fitzgerald, Chief of Surgical Oncology at the Maine Medical Center Cancer Institute. He encouraged us to examine best practices for prehabilitation for GI cancers in order to make recommendations for their new oncology unit. Also, I would like to acknowledge the UNE librarians who helped with research assistance. We separated the GI cancers into 3 categories, the 2 main being colorectal and pancreatic cancers, because they are in the top 10 incidence rates and top 4 for mortality rates for all cancers. So these conditions are becoming more life-threatening as the years progress. Our research yielded for colorectal cancer that prehabilitation, which include resisted and cardiovascular training, has shown positive results for postoperative outcomes, functional capacities, and disease-free survival rates. Prehabilitation has not shown improvements for patients who are frail or reduced postoperative complications and length of stay. For pancreatic cancer, home-based prehabilitation has shown to reduce postoperative and pulmonary complications, length of stay, and associated costs, and may increase adherence to exercise. Supervised prehabilitation can significantly increase the muscle strength and body weight of patients pre- and post-operatively. For other GI cancers, prehabilitation has decreased the need for vasoactive drugs, rate of surgical cardiovascular complications, and has shown improvements in cardiopulmonary and functional capacities. Our literature review demonstrates that prehabilitation is feasible for GI surgeries and produce good postoperative physical outcomes. Individualized exercise programs prescribed by skilled clinicians is recommended by ACSM. And if anybody would like to read more about our research, we are going to publish our literature review on DUNE. Thank you.
Thank you for attending our virtual poster session. And we all want to say, stay well, take care, and be kind to each other.